So what I would like to do is to first ask Dr. Boffa and Chansey Paech to take the podium to do their speech. Just to introduce Chansey. Chansey is the director of the Congress Board, as I said. He is a descendant of the Eastern Aranda Nation and is involved in various organisations and is passionate about making sure our people live long and healthy lives. I think Dr. Boffa needs no introduction. We all know him, so I'd like to ask those guys to come forward and take the stand.
All right, I may not be as pretty as Donna, so I'll try and give it a go. I'd first like to acknowledge the Aranda people, their elders, my elders, both past and present, who are the traditional owners of the land we're meeting on today, and their native body title, the Laratupa. I'd also like to acknowledge my fellow board members out there today, and the Congress staff and the Congress management. Without them, our organisation wouldn't be as successful and as strong as it is today. I'd also like to just say I was asked briefly yesterday how I found the conference so far, and to sum it up in one word, and I suppose that one word I'd have to say would be deadly. It's so inspiring to come to a conference like this and meet a whole range of stakeholders in the Aboriginal health and medical services who are dedicated to delivering comprehensive and primary health care to our people, who are there because they're passionate about changing the lives of our people. So it's been quite an experience so far, and I look forward to hearing many of the other presentations throughout the day. If there is anything that I do raise on today that you would like further discussion on, I know myself and I'm dobbing in my fellow directors who are at the back up there. We're happy to take any questions and try and answer them for you. I suppose today I would like to talk to you about innovation in everyday business of an Aboriginal community controlled organisation. I'll discuss innovation and I'll use 3 recent examples of Congress's innovation and how we've overcome some challenges and how we've made practices that are put in place to really, I suppose, set an example and help other Aboriginal organisations out there with their governance structures and frameworks. So I suppose firstly, I believe we've trailblazed in innovation in governance. Secondly, innovation in alcohol treatment, and finally, innovation in early childhood services, which our early childhood services I see as groundbreaking. So I hope you enjoy the presentation that Dr. Boffa will talk about today. In all these examples, research has played a key role in informing what has been done, and independent valuations has been a major key part of this. It's working today. Innovation in governance. Before I start on this, for those of you who were in attendance at dinner last night, there was a very important question asked by one of our performers, Warren H. Williams, and that was around how we as boards ensure that we are listening to our younger generation and also our LBGTI community, which is lesbian, gay, bisexual, intersex, transgender and questioning, which was a fantastic question that Warren raised, because it really is an issue or a matter that we have to deal with in coming times, because we have to be seen as being an accepting corporation or organisation, because we deal with the healthcare for everyone in our community. So I just wanted to start by just pointing out that Congress, in fact, has been a leader in this. Our organisation has a youth rep on our board. I am that youth rep. So we made a decision to ensure that we would maintain and listen and make sure that the voice of our youth in our community would continue to be heard. Also, our organisation deals with a range of programs that are inclusive and that are targeted at working with the LGBTI community and making sure that there are not any barriers there that those people are faced with. I myself am an openly gay person, so it's quite refreshing to see that Congress has taken this path to ensure that we are looking after our gay and lesbian community and that they feel welcome to come to our service and that there's no stigma with them coming to our service. So, I would like to express my congratulations to my fellow board members on Congress who have been very supportive and inclusive of that part of the community. I'll now continue on. As mentioned yesterday by Donna, our CEO, the Congress Board recently undertook some important changes to our constitution. One of those changes led to the creation of 3 specialist non-member director positions, and these are in the areas of primary health care, finance, governance and administration. Now, these positions are open to Aboriginal and non-Aboriginal people. There are, however, 6 positions that are Aboriginal identified. These positions are elected at the annual general meeting, and as you can see in the image here, with the exemption of James and Annie Helen, that is the current board. You can see my ugly mutt in the corner there, not as good as Donna, but so that's our current board, and I must say it's been quite a privilege to work with those people. They all bring a particular skill set and experience to the board, which allows us to have some robust discussions and really lead the way. These changes have greatly strengthened the governance of the organisation and led to stronger leadership and strategic planning. And for those of you who are not familiar, I'd suggest or direct you to our Congress website, and that will provide you with some information around some of the key changes, both in a leadership and strategic vision sense. So it's quite a groundbreaking time for us at the moment. The new board has developed a comprehensive governance charter that is based on best practice evidence, including evidence accumulated by the Australian Institute of Company Directors. As you can see, that's a portion of the Chairman's report, which talks about our governance charter. The charter identifies important characteristics around the board, including the authority of the board, the roles and functions of the board, and the critical issues, and clearly delineating roles between the board and the CEO, as well as other matters in the organisation. And that's just the start of what goes through in terms of the charter itself. There are many issues to consider in terms of the composition and operation of the board to ensure innovative governance practices, including the composition of the board, terms of office, election of office bearers, vacation of office, competencies, introduction, and board and director evaluation and insurance. Then there are many issues that relate to directors themselves, how they conduct themselves, confidentiality, communications, conflict of interest, and many other components that many people are not aware when they are appointed to a board. There are also many issues to think about in terms of board meetings themselves and the processes that ensure that they are effective, on time and run smoothly. Finally, there are some issues that we need to be aware of in terms of setting the agenda, the board papers, board calendar, the role of the chairman, secretary and treasurer. The development and adoption of this governance charter is an innovation for Congress and probably other community-controlled Aboriginal health services. The Charter is available on our website. If you head to www.cac.org.au, the Charter is made available to the public, and I would urge those community-controlled organisations out there who are looking at heading in this direction to strengthen their governance structures to go to our website. We're more than happy to provide any advice or assistance in relation to how other Aboriginal medical health services would like to go down this avenue. Speaking from my own personal experience, when I came onto the Congress Board 2 years ago, we didn't have a charter. We didn't have these things, and as a young person interested in benefiting the health of my people, I wasn't exactly entirely sure what my liabilities were and what my obligations were as a director. So having worked with my fellow directors and understand and put together a charter that also sets it out for new people, we go on a lot about we want to encourage young people to strive and achieve excellence, and we don't want them to fail. So by Congress putting together a charter is a step towards making sure that we're not setting up our young people to fail. They're aware of what they're getting into when they're coming into a community-controlled health service and their roles and obligations. So I congratulate the work of my fellow directors and the executive management team at Congress. I will finish there because I know that Boffa has a lot to talk about and he's quite excited about stats. So thank you all for your time. And like I said, if you are interested in having a look or talking further about our experiences, mine and my fellow directors with Congress, we are more than happy to talk with you at any point. Thank you.